Welcome back guys. Now let's discuss about lung volumes and capacities. So what exactly are these lung volumes? First we will be discussing about the lung volumes, later we will be going up to the capacities. What are the different lung volumes that you should know? First lung volume is tidal volume, TV. So what exactly is this tidal volume? Very simple. The amount of air that you will take in, or you can say the volume of air that you will take in and take out during quiet breathing. For example, see, now I am taking inspiration and doing expiration. How much air entered into my lungs? 500 ml. And how much air will come out of my lungs? 500 ml. So during quiet breathing, the volume of air that is entering into the lung and exiting out of the lung, that is called as a tidal volume. And how much the value will be? The value will be somewhere around 500 ml. Okay, I am giving the round figure. It will be usually around 500 to 700 ml. 500 ml, best answer. Okay. So you can see the definition over here. It's the normal amount of air, about half a liter, that is 500 ml, that you breathe during quiet breathing. Okay, just a breath in and breath out. Next step, what is inspiratory reserve volume? Okay, inspiratory reserve volume. Inspiratory reserve volume means the air that you can take extra other than tidal volume, the extra air that you can take in. Look at me, what am I doing? I am taking the tidal volume. If you ask me, sir, can you take extra air? Yes, I can do that. I can take extra air beyond the tidal volume. So that extra air is called as the inspiratory reserve volume. Okay. How much is that inspiratory reserve volume? It is 3000 ml. Okay, inspiratory reserve volume 3000 ml. The extra air that you can take in. Okay. Now, what is expiratory reserve volume? Simple. Expiratory reserve volume means the volume of air that you can take out beyond tidal volume. Normally, I am taking 500 in, 500 out. But if you ask me, I can take extra air out of my lungs. This extra air that I am taking out, for example, during birthdays, okay, blowing the candle or playing some trumpet. So you have to blow out extra air, right? So that extra air that you can take out, so that is called as expiratory reserve volume, and the value will be somewhere around 1200 ml. Okay, 1200 ml. Okay, it's the additional air that you can exhale. Next, what is residual volume? Residual volume means the air which will never come out of the lungs. Okay, it's always present in the lungs. It's never going to come out how hard you try. Okay, how much you bear down, it's never going to come out of the lungs. So that is going to be called as residual volume. And how much is that value? 1300 ml. So these are the 4 different volumes that you should know for your exam. These are the 4 different volumes: tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Okay. Now let me explain you these volumes in the form of a graph. See the diagram that I am showing you here, this is called as a spirometry. Okay, this is a spirometry diagram. Here what we are saying, guys, these areas which I am highlighting right now in the blue color, what are these curves? These are your tidal volumes. Okay, first number 1 point, from here till here. So what is this volume change? This is the tidal volume. Okay, so quiet inspiration, expiration, inspiration, expiration, 500 in, 500 out, 500 in, 500 out. So these curves are your tidal volume. But I have asked you, see, after taking certain amount of air, that is a 500 ml, if I wish, I can take extra air into my lungs. I can do extra inspiration. So this extra air that I can take, so what is this called as? This is your inspiratory reserve volume. From where to where? From here till here. Okay, from here till here. So this extra, this is your inspiratory reserve volume. And what is expiratory reserve volume? I have told you, see, this is the normal tidal volume. But if you wish, you can take extra air out of the lung. So this area which I am highlighting, this is what? This is the extra air that you can take out. So this is your expiratory reserve volume. Okay, this is your ERV, expiratory reserve volume. So tidal volume, inspiratory reserve volume, expiratory reserve volume. Okay. Now, whatever you do, how much ever you try, certain amount of air is always going to be present in your lungs. It will never come out no matter what. So this air, okay, which will never come out. So what is this area called as? So here, this area from here to here, this is called as residual volume, RV, residual volume. It's never going to come out. So these are the 4 volumes. Have I already taught you? You have to make a small change here in the values. What is the normal residual volume, guys? Always, what is the residual volume? How much air is always left over in your lung? 1.3 liters, that is the 1300 ml. So here I am showing you 1.3 liters, 1300 ml. Okay, 1300 ml residual volume. Okay. Now, students, please make 2.5 liters here and make 3. Okay. So now it will be better. Now, after discussing about the volumes, now look at the capacities. What exactly are the capacities, guys? Capacities are nothing but the addition of volumes, means the sum of volumes. Means if you add 2 or more volumes, you will get the capacities. What is the first capacity? Inspiratory capacity. What is the meaning of inspiratory capacity? Inspiratory capacity means tidal volume plus the inspiratory reserve volume. You tell me, what is the normal tidal volume? 500 ml. What is the inspiratory reserve volume? 3000. So 500 plus 3000, 3500 ml. So yes, 3500 ml is your inspiratory capacity, means the capacity of your inspiration. Okay, starting from resting position. See, from resting position, how much maximum air you can take? First you will take the tidal volume. After that you can take inspiratory reserve volume. So these two together called as the inspiratory capacity. Okay. Now let me show you the inspiratory capacity in this spirometry curves. From here, first you will take tidal volume. If you wish, you can take inspiratory reserve volume also. So this area which I am highlighting with the red color from here till here. Okay. So this red color line, it includes both inspiratory reserve volume plus tidal volume. So this is your IC, inspiratory capacity. Okay. The same you can see over here, from here till here. This is your inspiratory capacity. And what is the volume of the inspiratory capacity, guys? The inspiratory capacity value is 3500 ml. Very important. So now, what is functional residual capacity? Functional residual capacity is very simple. See, after quiet expiration, after normal expiration, how much air is left over in the lungs? Usually students will think it's a residual volume. No. Again I am asking you, after quiet expiration, how much air is left over in your lungs? That is your functional residual capacity. Now let me show you here. See, this is the quiet expiration, right? Inspiration, expiration, inspiration, expiration. This is the normal expiration. After normal expiration, how much air is left over in your lungs? Includes both expiratory reserve volume plus the tidal volume. Okay, tidal volume is, expiratory reserve volume plus residual volume. Both are there. So this area which I am highlighting here in the blue color, so this is your FRC, functional residual capacity. So from here till here, this is your FRC, functional residual capacity. And how much is the value of the functional residual capacity? Functional residual capacity value is ERV, that is 1200 plus RV, that is 1300. 1200 plus 1300, how much? 2500. So that's the same thing, 2500 here. So what is this value? This is the functional residual capacity, means the capacity at which the lungs are functioning. Okay, during a normal state, means I am at a resting position. I am at a resting position means like this. I am not doing inspiration, I am not doing expiration, like this. Now tell me, how much air is there in my lungs? That is functional residual capacity, FRC. Okay. So functional residual capacity is the capacity at which the lungs are functioning. Next, what is vital capacity? Functional residual capacity, it is a 2500. Okay, that is a RV 1300 plus 1200. Next, what is vital capacity? Vital capacity means after doing the maximum inspiration, try to understand, after doing the maximum inspiration, maximum possible inspiration, how much air you can take out of your lungs? Now I am asking you, take as much air as possible. So you will be taking as much air as possible, maximum inspiration. After maximum inspiration, how much air you can take out of the lungs? That is the vital capacity. So vital capacity includes, look at this diagram, after doing the maximum inspiration, now I am asking you, take out the air. So first what you will take out? You are going to take out the IRV, inspiratory reserve volume. Later you will be taking out the tidal volume. And if you wish, even you can take out the expiratory reserve volume also. You can take out expiratory reserve volume also. So from here till here, can you take out residual volume by any chance? No, you can't take out. So this is the vital capacity. Vital capacity means after doing the maximum inspiration, the air that you can take out, the maximum air that you can take out includes the IRV, tidal volume plus ERV. So that is your vital capacity. Here also vital capacity. The vital capacity, it is including these three, right? Vital capacity includes IRV, TV plus even ERV. How much is the value? The value will be somewhere around 4700 ml. Okay, which means this is the maximum air that you can take out of the lungs. Okay, this is the maximum air. The maximum possible air that you can take out of the lungs is 4700 ml. Okay, you can't take it more than this. Next, what is the total lung capacity? Total lung capacity means addition of all the 4 volumes, including the residual volume. That is vital capacity plus residual volume. Okay, if you add all the 4 volumes, that will be the total lung capacity, and the total lung capacity value will be somewhere around the 6000 ml. Okay, 6000 ml, or you can say 6 liters. Okay, around 6 liters it will be. Okay. So, in the spirometry, you can see the total lung capacity is from here till here, that is including all the 4 volumes. Now, it is very clear, right? The maximum air that you can store in your lungs is 6 liters. 6 liters. In that 6 liters, if you wish, how much you can take out? In this 6 liters, sir, if you wish, you can take out 4700 ml. That's the vital capacity, the maximum that you can take out. Okay, so my capacity, my lung capacity is how much? 6 liters, out of which if I wish, I can take out 4700. So how much is not coming out? 1300 ml. And what is that 1300 ml? And that 1300 ml is nothing but residual volume. So 6 liters, you can take out 4700, and what's going to not come out? Residual volume is never going to come out. That's 1300 ml. Okay. So with this successfully, what we have completed, guys, we have completed the volumes and capacities. Along with the volumes and capacities, we have also seen this image based diagram. This is a very important question, guys. It's an image. How the question is going to come? Image based question. They will be asking you, they will be marking this area, and they will ask you, what is this volume? Inspiratory reservoir volume. And very, very famous question. From here till here, they will mark and they will ask, what is this? Functional residual capacity. Okay. Done. Next step. After this, a few questions. Okay. See, in a normal spirometry, okay, you can know what is the tidal volume, certain things. But which volumes can never be measured? In a normal spirometry study, okay, in a normal spirometry study, which volumes cannot be measured and which capacities cannot be measured? So look at here, volumes and capacities that cannot be measured via the spirometry. Why you can't measure them? Because it will never come out. You tell me, residual volume, will it ever come out? Residual volume means the air that is present in the lungs always. Do you think it will ever come out? No, it's not going to come out. So if it's not going to come out, then how can you measure it via normal spirometry study? In a normal spirometry study, you cannot calculate or you cannot know the residual volume. Without knowing the residual volume, you tell me, look at this diagram and tell me, without knowing the residual volume, which capacities you cannot measure? See, without residual volume, you cannot calculate the total lung capacity. Without knowing the residual volume, you cannot calculate the functional residual capacity. Simple logic, right? So, functional residual capacity and total lung capacity, these two capacities cannot be measured via normal typical spirometry. Okay, done. So volumes which cannot be measured and the capacities which cannot be measured. Then how to measure them? This is a recent question, guys. Then what is the method to calculate the functional residual capacity? The best method, gold standard method, that is called as a body plethysmography. This is a gold standard method. So the gold standard method, body plethysmography. Apart from this, you can also use dye dilution methods, like you can also use helium dilution method, nitrogen washout method. So these methods can be used for the calculation of the functional residual capacity. Okay. So with this, the topic of lung volumes and capacities completed. Hope the video is helpful. Thank you.